We all enjoy spending time outdoors, especially when the weather is warm. Parks, gardens, hiking trails, these green spaces offer a welcome escape from our busy lives. But a hidden danger lurks in these idyllic settings: ticks. These tiny creatures, often no bigger than a poppy seed, can carry a range of diseases. While Lyme disease often steals the spotlight, another tick-borne illness poses a serious threat: babesiosis. Babesiosis is caused by a microscopic parasite that infects red blood cells. It's a serious condition that can cause a range of symptoms, from mild flu-like illness to life-threatening complications. What's particularly concerning is that many people with babesiosis don't even know they have it. They may experience mild symptoms or none at all, unknowingly putting their health at risk. This essay aims to shed light on this often overlooked threat. We'll delve into the causes, symptoms, and treatment options for babesiosis. Knowledge is power, and understanding this disease is crucial for protecting ourselves and our loved ones. Remember, early detection is key to successful treatment. By being aware of the risks and taking preventive measures, we can all enjoy the great outdoors safely. Babesiosis is caused by a tiny parasite called Babesia. This parasite infects red blood cells, which are responsible for carrying oxygen throughout the body. When Babesia enters a red blood cell, it multiplies, eventually causing the cell to burst. This destruction of red blood cells leads to a range of symptoms depending on the severity of the infection. The severity of babesiosis varies greatly from person to person. Some individuals may experience mild flu-like symptoms such as fever, chills, sweats, headache, muscle aches, and fatigue. Others, particularly those with weakened immune systems, can develop severe complications. These complications can include anemia, organ failure, and even death. It's important to note that babesiosis can be particularly dangerous for certain groups of people. Individuals with weakened immune systems, such as the elderly, infants, and people with HIV or cancer, are at increased risk of developing severe illness. Additionally, people who have had their spleen removed are more susceptible to complications. The good news is that babesiosis is treatable, especially when diagnosed early. Early detection and prompt medical attention are crucial for preventing serious complications. One of the biggest challenges with babesiosis is that its symptoms often mimic those of other illnesses. This can make it difficult to diagnose based on symptoms alone. However, understanding the potential warning signs is crucial for seeking timely medical attention. The most common symptoms of babesiosis include fever and chills, sweating, headache, muscle aches, fatigue, loss of appetite, nausea, and vomiting. In more severe cases, individuals may experience dark urine, jaundice, shortness of breath, confusion, and an enlarged spleen. If you experience any of these symptoms, especially after a tick bite or spending time in areas known to harbor ticks, it's crucial to see a doctor immediately. Early diagnosis is essential for effective treatment. Diagnosing babesiosis involves a combination of methods. Doctors will consider your medical history, including any recent tick bites or exposure to ticks. They will also perform a physical exam and order blood tests. These blood tests can detect the presence of the Babesia parasite in your blood, confirming the diagnosis. The good news is that babesiosis is treatable, especially when caught early. Treatment typically involves a combination of medications including atovaquone and azithromycin, which is the most common treatment for babesiosis. Clindamycin and quinine may be used in severe cases or for individuals who cannot take atovaquone and azithromycin. The duration of treatment varies depending on the severity of the infection. Most people require 7 to 10 days of medication, but some may need a longer course. It's essential to follow your doctor's instructions carefully and complete the full course of treatment, even if you start to feel better before finishing all the medication. Preventing babesiosis starts with avoiding tick bites. Here are some practical tips to protect yourself and your loved ones. Avoid tick-infested areas, wear protective clothing, use insect repellent, check for ticks regularly, and remove ticks promptly. By taking these preventive measures and seeking prompt medical attention, if you suspect babesiosis, you can enjoy the outdoors safely and protect yourself from this potentially serious illness.